Hi, Deborah. Very good morning to you. How are you today?
I'm good, thank you. Yeah.
Thank you very much for offering to do this for this conversation, really. Yeah, as you know, this is very much about the AP principles that we are looking to launch next month. And you have, of course, been a very key stakeholder in this process. So, yeah, through this conversation, we'd really like to think about your role and how you have been involved and shaped this piece of work, and more importantly, how the NMC can continue to work with you and the stakeholders that you represent going forward for embedding and implementing these advanced practice principles. So I'm going to start with the general sort of, can you tell us a little bit about yourself, your role, and specifically how you've been involved in the review of advanced practice that we initiated?
Okay, thank you. So I'm Deborah Sturdy. I'm the Chief Nurse for Adult Social Care. It's the first time we've ever had a Chief Nurse. So to be part of the advisory group in developing these standards has been really important. That voice of social care nursing is sat around that table. And I'm also pleased from the NMC's point of view that they appointed Pauline Shaw, who's a very experienced senior leader from social care, to actually help with the work. And for me, that felt like a real landmark moment where the NMC recognises that nurses practice in all sorts of settings, not just the NHS. So for me, it just felt a very fundamental and important part of the future for social care nursing, and the opportunities that I think that advanced practice presents for nurses working in social care.
Excellent. And on that point, what do you think about it? That there are two parts to the development of advanced practice principles and the general principle of us regulating advanced level practice. But from a public protection perspective, and from also the point about the whole career pathway that we can enlight really for people on this journey, from both those perspectives, what do you think about this piece of work in general, about the NMC developing additional regulation for advanced practice?
So for me, I mean, absolutely fundamentally, the core of business of the NMC is public protection. I think it's really important that the public understand, what a nurse does and what the both the expectations and the limitations to that practice are. So for me, I think that those are very important, and that is the fundamental underpinning point of having a register. And that kind of hallmark of professionalism. I think that we've seen this week with the protection of the title nurse, the kind of reinforcement for the public, that assurance that the person they see in front of them has an expectation to meet those standards. Just as a fundamental, to being on the register. So for me, that kind of definition and clarity about what advanced practice means, additionally, is really important as we see more and more of these roles grow in all sorts of settings across health and social care. I think it's really important we have that clarity and that assurance to the public that these practitioners are educated, are adhering to the principles as set out by these new standards, and that they can be assured of that kind of education attainment and that clinical experience of the person that is sat in front of them who is actually supporting and managing their care, has attained a level of competency that should assure them that they are getting the best possible care and treatment and support from that practitioner.
Absolutely. I mean, our evidence gathering that we did in the first phase definitely showed the general value, the great amount of value that these roles bring to health and social care. A lot of the stakeholder engagement has also pointed to that, and including feedback from members of the public, which has been front and center of this piece of work. And one of the things we recognized quite early on is that some of the issues that we're trying to grapple with in the regulation or the additional regulation of advanced practice are very much multifaceted. So it is not something that we can do in isolation. So we are a professional regulator, but of course we need to work with the wider system. And therefore the solutions that we are trying to offer are also multi-part. So, these principles are one part of many. So I think, and that's something that we are really trying to get across to our stakeholders. So I just like to know your views specifically on the introduction of the principles, part one, basically, and then the other parts will follow. And what specifically this would mean for those advanced level practitioners who are either seeking to become, advanced practitioners, who are supporting other advanced practitioners, or those who are already working for many years, particularly in the social care sector.
I think there's another bit of the assurance bit about this as well, which is about the profession actually being able to stand in front of their peers and other professional groups to so that other pieces, it's not just obviously it's about public protection first and foremost, but there is also something about that assurance as we see a plethora of new titles and new roles coming into the health and social care space that our peers and our kind of clinical colleagues that sit around us from other professional groupings actually recognise what those advanced practice principles mean and what advanced practice means in the context of nursing. So I think that's a really important point to make. Specifically around social care, I think that we are starting to see that the people investing in advanced practice. It's a very small number at this point. But if you look at how nurses practice in social care in that autonomous way, often in nurse-led services, and the skill that social care nurses have in that managing complexity, multiple comorbidity as educators, we're starting to see the green shoots of research, development and opportunities for social care nurses with the recent launch of an NIHCR program specifically for social care nurses. We're starting to see things to grow and I hope will flourish in the future. So this feels very timely for some of the other things that are developing in that social care nursing space. And again, I think for employers of social care nurses, seeing this as an opportunity for people to develop those clinical careers, not just having the only route into, as we've seen previously in healthcare, into sort of management positions to develop and grow their careers. So for me, this is about a broader impact around recruitment and retention and recognition of the complexity of social care nursing. And we look at that not only in the four walls of a care home, but we're seeing increasingly in domiciliary care, the complex care support for people in their own homes. So again, the society changes and people want a different care offering. We are going to need nurses who know those people well, who are going to be able to support them. And I use this this kind of mantra all the time. We spend hours of our lives in acute services and we spend weeks, months, years, and sometimes lifetimes in community and social care, being supported by community and social care. So I think there's that kind of growth of these, of advanced practice in social care is absolutely essential. And again, for people who are living behind their own front door, knowing who that practitioner is coming through and to support them is really important. So I think from a professional point of view, great opportunity for nurses to develop skills. From a public protection point of view, back to what I was saying earlier, actually having that assurance that the level of kind of competency with that individual, and I think in terms of employers knowing what your kind of who's in your service and what they're there to do, and again I think that kind of I think it helps with the parity and equity and recognition issue across the system, that nurses in social care have equal competency to nurses working in the NHS. So I think it just gives clarity to we're all on the same playing field.
Yeah, I mean, absolutely. I think it's very reassuring to know that this is coming at a time when it's needed, because there are definitely opportunities that we hope, the development of these principles will provide. Because what we would really like is for employers, for professionals, aspiring advanced level practitioners on our register to look at these principles and think, what are the things that I would need to go down that path. But then equally, we want members of the public to look at these principles and feel that reassurance that this is what it means to be an advanced level practitioner. These are the things I can expect when I know that my care is going to be provided and managed and led by a nurse or a midwife who is an advanced level practitioner. So yeah, it's really reassuring to hear all of those things, that it is going to have that longer term impact on workforce, on professional development of the professionals on our register, and all of those things really. Coming back to the public point, which is quite pivotal to this, as I said, we got fantastic support from a very vocal, very committed public advisory group. We also have, and that was specifically for this piece of work. But in addition to that, we also have an NMC Public Voice Forum that was very, very generous with their time, and they were really engaged in this piece of work from the start. So that has been quite important. And in fact, it was on their suggestion, we decided that actually we want to have a public oriented definition that speaks to members of the public and uses the language that they are most comfortable with, and then have a separate kind of definition that would speak to the professionals, so that we're not trying to mix everything up in the same definition. Because, I'll admit it was a struggle to try and please everybody at the same time. But, having looked at the definition, having been part of the conversations, actually, what do you think about the definition itself? The fact that we have this kind of approach where we have a public oriented definition, and do you think it will bring value to members of the public? What sort of clarity and assurance do you think it
I
will
think
bring?
language is really important, and I think
Absolutely. Yeah.
as part of the principle of public protection, if people don't understand something, then they can't be protected, can they? Because they don't understand what we're trying to convey to them. So language and communication is absolutely fundamental to anything that we do, um, and I think that that's what's really important. If the NMC as an organisation, like I say, their founding principles about public protection, and therefore working with members of the public, with those people who, as we all do, use health and to some extent social care services,
Mhm.
is really important. I think that we also have to put effort into being, or the NMC has put effort into, and be assured that 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 it's accessible to all, because so
Absolutely.
what about people who have a learning disabilities? All that kind of easy read
Mhm.
accessible information is equally important, and we don't just use a single approach to that. So I think that was what I would say. But understanding is really important, and as long as those two definitions absolutely align in what they're trying to
Mhm.
say, that's why we have easy read versions of things, and that. So as long as they align, and there's not a different definition in one
Yeah.
space than the other, then actually it is absolutely the right thing to do, because that is in itself a form of public protection, people understanding what they can and
Yeah.
should expect.
Mhm. That's a really good point you've touched upon about bringing it back to public protection, because ultimately it is about providing that additional reassurance to members of the public in terms of the care that they can expect, in terms of who is the person who is providing that advanced level care to them.
Yeah,
Because we know, particularly in social care, that uh, actually across the board, regardless of the settings in which these professionals are working, we know that they are providing end-to-end care, managing complete episodes of care, right from diagnosis to managing the problem pretty much autonomously. There's, of course, a lot of uncertainty, and then managing that risk and uncertainty is pivotal to this role. So, as I said, this is just part one. So, the principles and the definition are one part of it. And the next element, or next part of our focus for this project is going to be embedding considerations for advanced level practitioners in the code and revalidation review, and then looking at developing education standards and proficiencies for these professionals. So, just looking forward to all of that work, and, generally looking at this concept of additional regulation for advanced level practitioners. What do you think that the opportunities and challenges are for us, as given the fact that we have a very sort of defined remit because we are a professional regulator, of course. So from your vantage point, what do you think we've got in terms of opportunities and
Well, it's like,
challenges?
I think it's anything, whatever we do, wherever we sit, whatever roles we kind of have, it's about that kind of collaboration and working together. So it's people doing, the thing that they're there to do, but actually that sharing, that promotion, that collaboration, those kind of views coming together, and it being a joint approach to me is really important. You can't get much done on your own, so collaboration
Absolutely.
is really important. And I think that that whole thing about how we communicate to the profession, the public, and to our peers is really, really important around this.
Mhm.
And again, the different perspectives, both in terms of developing things, but then in implementation, are, I think, are really enriching. I think to making sure that we're all doing the right things in our own space from our own perspective. So to me, that coming together and corralling people to support this work, because it is it's important, from research, from education, from practice, from that
Mhm.
kind of leadership, and those four pillars, and
Mhm.
for employers, it's a universal kind of what's the word? As it's a universal kind of approach to something that is really important for advancing nursing practice, for people who receive services wherever they may be across the system, being assured that that level and that kind of quality of that of the person who's sort of sat in front of them. And so that's that public protection bit as well. I think is really important, and we can only do that through active collaboration.
Mhm. I mean, that's a great point to kind of draw our conversation to a close, because I think there's a lot of work that we have to do going forward,
Yeah.
and we, as you rightly said, we cannot do it on our own. We haven't done any of this on our own, really. It's been very much a piece of co-production, collaborative working, and that is something that we're looking forward to. So stakeholders such as yourself are really important and pivotal to consider implementation of these AP principles, but also looking at the bigger picture in terms of how does it all fit in with the strategic priorities that we have as a regulator in terms of the code review, validation review, all very exciting things. And we would like to bring in the voice of the diversity of the register, and advanced level practitioners are one important group that we would like to keep engaged throughout all of this. And social care sector in general, I would say we want to really strengthen that co-production element with that sector. So yes, thank you so much. Looking forward to all of that exciting work that is to follow in terms of implementing these principles, and some of the formative work that we're going to do for code and revalidation.
Yeah.
So yes, thank you so much for your time today. Really
uh,
enjoyed this conversation.
yeah, I enjoy talking to you too. Thank you.
Thank you.